Next up, speaking on behalf of IHIT and the Franciscan Alliance is Andy VanZee.
So our idea came from some of the pains that I've heard when I talk to like HHICs and other organizations out there. Also, I worked at an ER for 3 years, and so I have a little bit of understanding of some of these problems. But so I had put forward the challenge, kind of an idea and concept. And then when we were looking through the challenges, Franciscan Alliance, basically there were a lot of synergies between what we proposed and one of the challenges that they were seeing as part of their efforts. And so we decided to bring the two together, which is kind of the general concept of today, of bringing groups together to solve these problems. And so, I've already talked a little bit, about IHIT, but Franciscan Alliance is a 14-hospital system with 18,000 employees. Serves Indiana and parts of Illinois. It is one of the few pioneer ACOs, and so here in the state. And so I think it was 23 ACOs across the country in this initial group. They're also then taking part in the Medicare Shared Savings Program. So you can see they're all about figuring out how to change the healthcare paradigm to be able to deliver lower cost and better patient care. And so just kind of show you how big of a problem this is. There are currently 36 million ED visits a year across the country. 106 of these million of these are receiving medication. So it's not just something simple. They're actually receiving some sort of major intervention or medication. Only 15% of these are actually admitted or transferred to another hospital. So 85% of these patients that are coming in through the ED are being sent out to other organizations or sent back home. Of those, 85.6 million of those that are discharged are suggested to be either referred to a physician or to follow up with their physician or clinic. And so our challenge is has two use cases. The first being an ED discharge of a patient to follow up with a provider, or the second being a physician referral to the ED. So an organization determining that a patient needs to be sent for further and more advanced follow-up at an emergency department. And so the overall concept, the needs we see is the ability to do follow-up scheduling. Also to be able to share information from these providers to the ED and vice versa, and then also working on notifications of either these referrals in both directions. So some of the key considerations for whatever solution needs to be highly customized based upon user preferences, both from the ED and referring physician side. It needs to have the ability to share health data using some of the standard protocols that have been developed across the country. The ability to work with multiple EHR vendors. So we have a very diverse ecosystem out there with health IT products, and so this solution should be able to integrate or be seen as a system that can work with other systems. So we hope you'll come to room 160 to help us solve this challenge.